at the current moment, with all the bed calculation, both private and public, we know that in June we wouldn't be having any bed actual shortage, but towards the end of July, we will be having a bed shortage which we need to actually make up for. That is the reason why we are pushing hard that we get field hospitals to be ready to be able to offset that. And in that process, in that parallel process, we are still building extra capacity in Kopanong, in Bara, at George Mukari, and actually Jubilee, which is permanent structures which are not going to be, which we are going to repurpose post the pandemic to serve the system. So we are putting all the systems to make sure, that I was not one of in favor of field hospitals before, but because of the gaps that we saw and predicting now, that's why we really need to complete our field hospitals to be in place by end of July.
MEC, I know you're in the process of gathering a report on alcohol-related incidents in your trauma units. Have you been able to gather that report, and what impact does that have on, I guess, the resources that were intended for COVID-19 now being used towards alcohol-related incidents?
The data has been collected. I think the clinicians who are dealing with trauma, they will present to the command council when we're going to be having this discussion. And it's clear that those who require ICU, who have been in trauma-related incidences, we are now competing with them, for COVID patients. And it has done a great deal, slightly slowing us down in terms of our preparations and our state of readiness.
Who gets priority in the trauma units?
Unfortunately, it's an ethical question. There is a very lot of discussion that gets into the discussion itself, and it brings a lot of emotions, it brings a lot of prejudices. There is a criteria that clinicians use, and in this state it's important to mention that it's clinicians who should take decisions on who gets onto the event and who doesn't get to the event. An official and a politician shouldn't even come close to those discussions, because it's not them who make those decisions. It should be the doctors.
As an MEC, should it be a COVID-19 patient or the victim?
No, it should be about the clinician's decision who needs it more, and it shouldn't be what I feel, and it should be like that, So whether it's a person who was stabbed during a bar brawl, or a person who was infected with COVID, it should be still a decision of doctors and clinicians who actually has to get into the event.
And as a doctor?
As a doctor, I will have to make sure that who does need it very well, in terms of saving life, who needs it more than the other. Because life, in any case, whether COVID or not, it's still something that is precious that we need to fight for.
But one would hope that it would be a COVID-19 patient.
That's your view.
No, I'm asking.
That's your view. We'd still have to preserve life, whether it's COVID or trauma. We still have to try to preserve life.
And when you say that they're competing, it's possible that we may come up with situations where a COVID-19 patient won't be able to get an ICU bed? Is that
possibly? And that's what clinicians must make decisions on.